Hello everyone, my name is Akua Tandoh. Today I present on behalf of the project team a study on unhealthy food and beverage practices in everyday life in Ghanaian cities. Data for this work was derived from two sister projects focusing on dietary transitions in Ghana. These projects were known as the DFC and TACLED projects. Just a brief background to why these projects were needed. Ghana is currently experiencing changing food environments and the accompanying transitioning of people's dietary practices. This is contributing to high prevalence rates of obesity and overweight and poor health outcomes from diet-related non-communicable diseases. Presently, there is little evidence on the driving role of urban environments on dietary practices. This requires an exploration of how food consumption is structured and organized in social practices to help develop context-relevant interventions and policies to promote healthier diets. Hence, in this study, we explored how eating practices and routines drive unhealthy food consumption in everyday life in Ghanaian cities to be able to identify interventions and policies that could promote healthier diets. Now, what did we do? Our study was cited in two Ghanaian cities, Accra, which is the capital city of Ghana, and Ho, which is the capital city of the Volta region. We targeted deprived neighborhoods in these cities and recruited participants with the quota sampling method. In total, we recruited 301 female and male adolescents and adults who were at least 13 years old and above. We then conducted qualitative, in-depth 24-hour recall interviews via face-to-face with all study participants, collecting data on all food and drink consumed inside and outside the home in the previous 24-hour period. We also recorded the time of day of the food event, how long the food event lasts, and who participants ate with, and where they were when they ate. We then calculated scores to indicate the healthiness of foods based on energy and nutrient density using food composition tables and nutrient profiling methods. After this, we developed 5 measures of healthiness of food and beverages. These measures were based on nutrients and unhealthy food types. We had energy-dense and nutrient-poor foods, energy-dense and nutrient-rich foods, fried foods, sweet foods, and sugar-sweetened beverages. Now, what did we find? We found that most study participants consumed unhealthy foods. However, consumption of traditional foods that are nutrient-rich but energy-dense persisted, with well over 89% of the sample consuming these. Also, low socioeconomic groups were more likely to consume unhealthy foods, and individuals who ate more frequently were less likely to eat unhealthy foods. With regards to the time of day of eating episodes, we found that the dominant meal pattern was structured around 3 main meals a day with few snacks in between. Breakfast was normally between 7 a.m. and 8 a.m., and the evening meal was between 5 p.m. and 7 p.m. Now, on how long people eat for, we found that most eating episodes were quick, either lasting less than 10 minutes or between 10 and 29 minutes. We found that shorter food episodes were more likely to include greater intake of unhealthy foods, sweet foods, or sugar-sweetened beverages, in contrast with longer food episodes which contained more traditional foods that were nutrient-rich, but also energy-dense and often fried. On where participants eat and who they eat with, we found that Eating at home, either with family or eating alone, was common. Meals with family were more likely to be healthy, with fewer energy-dense nutrient-poor foods, but more energy-dense nutrient-rich foods. Also, we found consumption of fried foods and sugar-sweetened beverages were higher with friends. Now, what does this tell us? This tells us that families and home environments are key to ensuring healthy diets. Longer meals were also more likely to occur at home and unhealthier foods eaten in schools and workplaces. Now, what are some of the implications of our findings for intervention? The home environment and families are an important setting to promoting healthy diets. We also see that low socioeconomic groups are more likely to consume unhealthy foods. Hence, action around enhancing access to healthier foods and actions to limit access to unhealthy foods are required to promote public health goals. Also, awareness about eating well when with friends could be emphasized as part of intervention. Thank you for making time to listen to this presentation.